trying to put, I make some note card.
Okay. Okay.
So hopefully they help.
Okay. What else has everybody been doing to prepare?
Listening to the reviews, doing the Kahoots.
Okay. I kind of gave you guys what I thought was a step-by-step way to prepare for the exam that I felt was helpful in an announcement this week, right? To review the lecture material, right? Make
Mhm.
sure you understood that, cross-reference that lecture material and notes. I sent you a couple of Kahoots, right? Week 7, there's a Kahoots for every week, right? Then I sent you guys additional Kahoots that have to do with levels of prevention and levels of prevention in ADPI. Okay, so reviewing those and then cross-referencing everything with your study guide, right? Everything should fall in place. All the dots are connected. Are you seeing that as you're reviewing this material?
Yes.
That's the most important thing, is that you're connecting dots. You're connecting dots with lecture, all the additional activities that we're providing you, study guides, Kahoots, all of that, the study guide. It should all be interconnected. Has anybody had the opportunity to review the levels of prevention in the ADPI Kahoot? I'd like your feedback. Was it helpful?
I don't think I seen that one.
Yes, it helped me.
Did it help?
More.
Okay. Okay, if you haven't seen those and you're, ask your professor to provide those to you.
Thank you.
Okay. One of our professors did an excellent Kahoot specifically on ADPI, and then one specifically on levels of prevention. That was excellent. Excellent. So get a hold of those. Okay.
Okay.
They're
I
good.
don't think I've seen that in my announcement. Okay.
Okay. What else is that what you're doing to prepare? Kind of what I'm summarizing here. Is that what you're doing?
Yes.
Everybody?
I see the head.
Yes. Professor Marvel,
Yes.
Jamie Wilson is asking if you could let her in. She's in the waiting room.
Okay, I don't have anybody in the waiting room right now. She hasn't popped in yet.
Oh, okay. I'll let her know. She might
yeah.
be in the wrong Zoom.
Yeah, she hasn't popped in yet. I have nobody in the
Okay.
waiting room.
All right. Thanks.
Okay, and
Professor
then
Marvel,
yes.
I'm actually one of Dr. Lundy's students, and I'm just trying to get as many of the recording sessions in live, as well as listening to the ones I couldn't make. But those are very helpful for us. But I am having trouble. Like, I accessed the Kahoot that you're just referencing, and I could not get back. I've only done it like once, and I was going to go back and look at it once more after I've studied again. I can't access that again. It won't let me.
I can't neither. I'm a Dr. Lundy student too. I can't do this.
Wait, you can't.
Is it possible?
Is
it possible if we give your email, you can at least send this to us, please?
Actually, I'll be reaching out to all my teammates after this, and I will let them know what you're saying. So,
Okay.
And make sure they get it to you. So what you're saying is, if you go through the Kahoot activity once, you can't repeat it, or you can't even get into it.
That's correct. You can't. You can pull it back up, but it won't allow you to sign in and actually go through the Kahoot again. So,
Okay.
I mean, you can log into it, but this has happened before. Each session, as you study and you go back to review and see if you're really retaining the knowledge, you can't access it again. So.
What I'm wondering is with Kahoot, I don't know a whole lot about Kahoot. If you can go back, irregardless of whether it's these ones or anyone, what I
do, what I do when I go, I just put like a different name.
I try that. and it won't even let me log in.
Oh,
It
okay.
just sits in
Okay.
place. Yeah, I've done that. And other professors I've had, we use the Kahoots and I really do like them. But I can sign in, just change my name or, just put a different initial or whatever. So, but it does, you can play on other professors, in other classes, we've been able to play them.
Okay, maybe it's just in this, maybe it's just in the settings.
Yes,
I'll have to
maybe.
have, okay, I'll have to have Professor Price, who puts these together. I'll check in with her after this review about that.
Thank you.
Has it-
Yes, perfect. Thank you.
Okay, yeah. Has anybody been able to review any of these Kahoot activities a second time or a third time? Anybody
No,
else?
I didn't.
I do like
couldn't.
4 or 5 times.
You have, Mary Jo,
Yeah,
done it 4 or
yeah.
5 times?
Yeah.
How have you gotten back in to do it?
I just use a different initial.
Okay.
And yeah, that's
It's-
all I do.
So you've been able to do it. Here's Jamie, whoever is telling me Jamie was in the waiting room. I have her now. Okay, so sounds like Mary Joy has been able to go back in and review them 4 or 5 times. So,
Yeah.
but I will provide Professor Price the information. It sounds like it now with one of the Kahoots, I think it was the levels of prevention Kahoot. Whereas Danielle sent me an email. Danielle, which one was not working that I had to go and get another link? Was it the level?
It was the levels of prevention. but
Right.
The other link that you sent works.
Right. The
Yeah.
new link I sent.
Yeah. Right.
So for those of you asking about this other Kahoot, we had to resend the level of prevention one. So make sure you have the updated one, right? The first one I sent was not working. And some of my students reached out and said it wasn't working. So we got the corrected version. So just make sure from your professors you have the corrected version. Okay. For all of you guys that are coming in a little bit late, please put your name and your professor in the chat so I can send this off to my teammates. Okay. All right. So what I'm going to, when I do my reviews, I like to go from the study guide. Okay. There's a PowerPoint that one of our teammates did, Professor Apple, that I may use a couple of her slides to refer back to, but it's a summary of our study guide. So I may go in and use a couple of those slides, but other than that, I'm going to be going right from the study guide. Okay, that's the way I like to review. It's right there in front of us, and that's what you guys are reviewing. So I'd like to keep everything coordinated and not introduce new things at this point. Does that make sense?
Yes.
Okay. For those of you guys there's 3 or 4 people that just came in the last minute, put your name and your professor in the chat, please. Okay, there's the PowerPoint, which I would like to, and then our study guide. Okay, here's our study guide. Okay, everybody have their study guide out? Okay, so if you've reviewed the study guide, most of this information should be familiar with you. There's a lot to cover in this exam, a lot of chapters. Okay, and here it is at the top. There was some additional resources at the back of this study guide with math. I hope everybody took the time to see that. If you, it's at the very back here. Okay. There were some resources about our reminders, know your drip calculations, how to set up your formulas. Okay. Did everybody see that? Okay. Hopefully you should know this, but if you need a review of how to set up your drip calculations, they're back there in the last page. What will help, I've already said this, case studies. I send my students case studies every week with all the PowerPoints. And so the case studies, I believe, for each chapter are very important to go through simply for the case study. But what I find the most helpful in the case studies is the rationales. Okay. And my students have heard that from me week after week. We use case studies as we're preparing study guides and exams as well. So I truly believe that anytime you can find a rationale, whether it's in a case study, whether it's in Kaplan, whether it's in NCLEX, anytime you can read through rationales are always an important learning tool. Okay. We want you to be able to recognize the concepts, make sure that you're looking for questions that have prioritization, language such as what is the most, what is the best, what is the least, right? What is the priority? What is the least priority? You have to be able to pull out questions. I'm right here doing assessment of prioritization. You have to be able to pull out keywords. Okay. And I find that when I do my reviews and we review questions, a lot of students feel like they miss that keyword. All the answers that might ask you a question in which all the answers are correct, but they miss the word priority, which is the best answer, which is the priority answer. So I would highly suggest you take the time to reread the questions, maybe a second time, maybe a third time, just to make sure you haven't missed a keyword. Okay. And always remember safety first. Remember your ABCs. Here's your what is a priority, and then prevention levels related to each chapter, right? We go through this every chapter, every week. We review our Healthy People 2020 box, and we review our levels of prevention. I've noticed throughout this term for the first two exams, quite a bit of incorrect answers with levels of prevention. So we need to make sure that you have a good understanding of levels of prevention. And more than primary is education, secondary screening, tertiary is management or rehabilitation. It goes beyond that. You have to be able to take those levels of prevention and apply them to each chapter, each topic. That's why every chapter has a box. So in the reviews that I've done, the tutoring sessions I've done, I've encouraged students to go back to those boxes in each chapter, at least for this test, with all these chapters above here. At least just go back to these chapters, find those prevention level boxes and read through the examples. Because, for example, if you think education is primary, well, education is also involved in secondary, and education is also involved in tertiary, right? So we need to think of primary bigger than education, prevention, right? Because think about, yes, education's in the primary level because you're trying to educate to prevent, and think about education in the tertiary level. They already have the disease, they already have the issue, and you may be teaching them how to manage that, say somebody with diabetes. All right, education is still going to play a role in your tertiary level, right? Teaching them how to manage, right? And then education also plays, I'm just trying to give you an example of not getting tripped up on the word education and only apply it to primary. And I think we went through this in class last week, at least in my classes, because when I did a few reviews the week before last, I found that students were saying to me, well, it's education, so it has to be primary. No, that's not true. Education goes primary, secondary, and tertiary. Does that make sense? Anybody?
Yes.
So you have to be able to think out of the box with each chapter's level of prevention, because the expectation is that you can give us a primary, secondary, tertiary level for each chapter, each topic, each concept we're covering. A primary prevention level might look different for a cultural assessment versus a safety assessment, right? A tertiary level of intervention may look different for the occupational setting versus a school setting. Okay, but they all have the same basic premise, where primary is your education, your prevention, you're trying to prevent something before it's happening. Your secondary, right, is your early identification, your screening, you're trying to early identify and early intervene before it goes into tertiary, right? So you're trying to stop the spread. And then tertiary, it's already in place. You already have the disease, you have the issue. And now you must look at trying to rehabilitate or manage whatever you have, right? And trying to teach about what is the best way to maintain the best quality of life after already having the disease. I don't want to get too far off in a tangent, but it's really important that you have an understanding of these levels of prevention. So that's exactly why I would encourage everybody to go back and look at the boxes in the chapters, as well as that Kahoot activity. I think it had 40 questions. Okay, so that's my little mantra on levels of prevention. And then same with ADPI, okay, which is right here. So the nursing process. So the expectation is that you have such an in-depth understanding of the nursing process, which is your ADPI, that you can apply it to each of these chapters, each of these topics, each of these issues, right? So how do you apply the nursing process? It's taking it out of the, say, acute setting. Okay, how do you apply the nursing process in the community setting? You're still using the nursing process, but the nursing process for admitting a, let's say, pediatric patient in the hospital is going to look different than doing a pediatric assessment in the community. Okay, so you have to be able to take the nursing process and apply it into the community setting. Okay, and then last was Healthy People 2020. You do have to have a understanding of what the Healthy People 2020 objectives are for these chapters. Hang on, sorry, I'm just letting in a few more people. So if you're asked a question on the exam and the question even has Healthy People 2020 in it, what are they looking for? What answers are, what are the only correct answers in those questions? That's a question to you guys. Pardon me, Danielle?
Answers that are focused on prevention.
Right, and that are part of Healthy People 2020.
Right.
Right. So when we ask you, pick the correct answer for, what was the previous question on an exam? What should we be communicating with new parents? What is a Healthy People 2020 goal for communicating with new parents? Well, all the answers were good answers. One was nutritional needs. One was, I forget what the other answers were, but there was only one answer that was a Healthy People 2020 objective. A lot of people got that question wrong because all the answers seemed correct, but there was only one correct answer, right? Because that was the only one that was in Healthy People. So don't get tripped up in your Healthy People 2020 questions, okay? They're looking for specific Healthy People 2020 objectives. They all may seem good, but there's only one that would be Healthy People 2020. Does that make sense? Okay, so some other tips here, helpful hints, best practice to review Kahoots, review readings, projects, discussions, Zoom weekly sessions, attend a exam review. Okay, anybody have any questions, at least on that introduction? So this exam study guide is broken down into all the sections, all the chapters, or excuse me, it's broken down into sections that encompass each chapter. Okay, so for example, community assessment and evaluation. What I would like to try and do in this study guide is just pull out the important points in these little paragraphs, and let's try and anticipate what kind of question or what might you be asked on the exam. Okay, so we know in this first section, it's telling us that community refers to the dimensions of person, place, and function. Okay, and what is this is what makes up a community. So what is the definition of a place, a person, a function? Okay, so in measuring the dimension of people, when we're trying to assess the dimension of people, what would we look at? Okay, we'd look at access data sources from, say, census, tourist bureaus, civic groups, and churches, right? The second would be, how do you assess the dimension? Okay, excuse me, how do you assess the community's function, which is, what do they do? You go to libraries, police stations, welfare agencies, State Department. State departments would be good data sources to measure the function. And then how do you measure the place? Data sources of maps, newspapers, and local housing office. I'm going to switch back because I've circled a couple of these slides that I want to go to in this PowerPoint because it gives a nice summary of it. So bear with me. That was slide 2. Okay, so here's what we just talked about. This is a summary of the PowerPoint. All right, it just breaks it up and just sections it out. Okay. Same thing, same information, but it's in this PowerPoint. Okay. When you do a community assessment, okay, what are the common community systems found within a community? Right? What makes up all of the community? Okay. And it's right here, these five things. Okay, politics. This can be found in every community: politics, education, recreation, economics, and religion. Some may be more important in certain communities than others, right? But when you're completing a community assessment, you're going to have to include all of these 5 systems. And what does each community look like with regards to each of these common categories found? Okay, again, remember the topic we're talking about: community assessment and evaluation. What's important what's important for the healthy function of a community? Active and passive partnerships, right? I don't know how well you know your communities, but you should. What happens? Who participates? Who partners with your community to make things better? To fund certain things, to build playgrounds, right? Active partnerships are critical for community functioning. So community partnerships focus on active participation by community leaders, businesses, and organizations to develop programs with healthcare people, right? The programs have a larger goal of collaboration to achieve an outcome that benefits community members. Okay, so that's what a partnership is. Can anybody give me examples of community partnerships in your community? There's always partnerships in community. What are some examples?
Doing after school, partnering with people that do after school program.
Yep, exactly. Right, so an example of an active partnership would be a business that provides low-cost snacks to an after-school program.
Is the one that do the food banks, are they active partnership?
Yeah, yes, absolutely. Absolutely. And then you have a passive partnership. I want to see if, let's see, slide 4. She gave a, no, this, okay. I don't. And then you have a passive partnership, which are kind of people working behind the scenes, right? The cities, creating a new park, a city creating a new park, a hospital providing a vaccine clinic, recreational center offering cooking classes, or passive partnerships. So there's a difference between active and passive, and we need to know the difference between those two. Sorry, I'm just pulling out in each paragraph, I'm just trying to pull out some of the important highlights. Okay, and then in order to do a community assessment, you need data. All right, so we will do data gathering and data generation. What's the difference between the two of them? It's right in the data gathering. We're having to gather data already exists. All right, data generation, we're having to create it. So let's go through this. Data generation is the process of identifying data that already exists. I'm sorry, excuse me, I'm sorry. I have that backwards. If you're generating data, you are identifying data that does not exist, but you have to have interactions with the community to gather that data, right? That's talking to people about their values, beliefs, and social norms. So you're generating data. Where data gathering is the process of collecting information that already exists, right? So you can find out what is the makeup of your community as far as residents, what's the age, what's the racial distribution, what's going on in the community. Does that make sense? So there's two types of data of collecting part of your community assessment, data gathering and data generation. And then we all should know at this point what a windshield survey is. What's a windshield survey without looking at this? It's a windshield survey.
A method of collecting data.
How?
Driving around your
Um,
community and
By observing.
observing.
By observation.
Yep. And what kinds of things do you look for when you're, remember, we're doing a community assessment. So what kinds of things would you be looking for in a windshield survey?
Hospitals, churches, socioeconomics kind of things.
Community parks.
Yep. What are the roads like? What are the other places of gathering? Are there parks? Are there recreation centers? Where do people gather? Is it clean? Is it dirty? Is it, windshield survey, you can get lots of information, right? What is the community's boundaries? Make sure you're staying within the boundaries. What's the population size? Okay, like you said, what are the governmental structures? Okay. Okay, any questions about community assessment and evaluation? So I've highlighted some words, but don't just go with my highlights. I mean, you need to make sure you understand all of the information in these paragraphs. Any questions on community assessment? Okay, let's move to evidence-based practice. What is evidence-based practice? What is evidence-based practice? Anybody have a definition of that? It's how we practice nursing. What do we try and do?
Something I've been researching and proving that it works.
Improvement of
right? Evidence-based practice is that we are practicing in our profession with the best evidence that we have in our whatever kind of nursing you're working in, right? And it's evidence-based. So think about COVID. We didn't know a whole lot about it 2 years ago. But as we start to learn more and gather more information and have more cases and treat more cases, there was evidence-based practice going on. So we continue to improve our care for better outcomes. Okay. This was evidence-based practice. This is in research journals. It's in studies. It's in surveys. We gather evidence-based practice from a variety of places, but the goal of evidence-based practice is always to be using the best evidence, the best protocols that we have. So the example I use is, let's say you have 5 major hospitals in a city and everybody's doing a study on let's say post triple bypass. Okay. And one of the hospitals seems to be able to discharge the patients a day earlier, right, than the other 4. Well, what are they doing differently to promote a quicker discharge with still the same quality outcome? That's so we would look to that hospital to find out what they do. What do they do differently that we're doing that we may be able to adopt? It's sharing information with your peers, with your colleagues. That's what evidence-based practice is all about. Again, look at COVID. Look at how we're dealing with COVID 2 years ago versus 2 months ago with all the evidence we have now. So evidence-based practice represents a cultural change for sure, right? It provides an environment to improve both nursing practice and client outcomes, right? The first step towards implementing evidence-based practice is recognizing the current status of one's own practice and believing, and this is important right here, believing that the care based on the best evidence will lead to improved outcomes. So you have to have the mindset. I mean, have you ever worked with a person that said, oh, don't worry, we've been doing it this way for 50 years and it's fine. Don't worry about it. We don't need to do it a different way. Have you ever worked with a person like that? I have. Okay. It can be challenging to accept the new practices, right? And that's what the last part of this paragraph talks about is the barriers, right? What are some barriers to adopting new ways of doing things, such as technology? Okay. When I worked in the schools, there were a lot of people who had been in the school system for a long time. And as technology was improving, they were very reluctant to use it with regards to developing lesson plans and, how to teach. Right. So some of the barriers to adopting and implementing new technology, such as their willingness to embrace new evidence-based practice, right? Knowledge of research and current evidence, right? And attitudes. You all should be going into the nursing profession with the idea that you will perform your nursing duties whatever site, whatever environment you're working in, based on the best, sorry, I thought I had to sneeze, the best practice out there. Does that make sense? That's what evidence-based practice is. And you have to be willing to accept and help bring your team along to changing it up, changing the way you do things, changing your practice based on the current evidence. Okay. It's not as easy as you think. Okay. Anybody have any questions on evidence-based practice? Does that make sense? That was the long way around explaining it to you. Like working in the schools for 20 years. I mean, the way we did things the first year I started from the way we were doing things this last year before I retired, night and day. So as school nursing evolved and evidence became available, we did things differently. We changed up course, changed our procedures, our methods to support all the new information. And our primary avenue for information was the National Association for School Nurses. Okay, we operated with their goals and mission statements, and things were always evolving. We were always reading peer-based reviews and peer-based evidence. Okay. Disaster management. The community nurse plays a critical role in disaster management. Okay. Disasters are labeled as natural or man-made. Okay. Give me an example of each. What's a natural disaster without reading this?
Natural disasters.
Hurricanes.
Yep.
Tornadoes.
My kids.
Yep. Mine too. Good one. That's a good one. That's a good one. Man-made. What are man-made disasters?
Water supply contamination.
Water,
Fires.
oil spills.
Yep. Pollution.
Fires.
Yep. Okay, so we have to understand the difference of natural and man-made. And in the disaster chapter, there is a nice box in there that goes through some examples of natural or man-made. I just need you to know the difference between the two of them. Okay. And then Healthy People 2020 comes into play in this chapter. Okay, so you need to be aware of what their objectives are related to disease mitigation. Okay, so please put this on a card or go into Healthy People 2020 box and disaster management chapter. And if anybody has the book pulled up, go in and find it for your teammates here and let them know what page it's on, and we can write that out here on the side. So Healthy People 2020's objectives for disease mitigation focus on preparing, alerting, and caring for disaster within a
I know
population.
it's in chapter 14. I don't know the page for Healthy People 2020. But
Okay, so chapter 14, what chapter?
14.
Okay, so yeah, so if anybody wants to go into chapter 14 and find us the Healthy People 2020 box, that's a start. So thank you very much. So this goes through what the Healthy People objectives are right here. One objective focuses on increasing the proportion of crisis and emergency risk messages to protect the public. Right? Home safety and safe driving will decrease the injury to the population, but it's not a preparation for disasters. Okay, same with, so right here goes through what is not preparation. Does that make sense? So you have to understand what is in there. Okay. Okay, another important topic that we want you to understand is how to teach a family how to prepare a kit for a disaster. What's in the kit, right? Stock enough food for 3 days, review the kit every 6 months, ensure all members know where the kit is located. Make sure everybody knows how to turn off the utilities. Review the supplies every 6 months, verify there are no expired items. So if you had a question about how to prepare a family, in disaster management preparation, what kind of question might you get right here with this paragraph?
Select all that apply.
Right. Okay. Maybe select all that apply, but what would the question be?
like, what do they need to have in their natural disaster kit, like tools and?
Sure. In teaching a family how to prepare their kit for a disaster, what are the key components that you need to think about? Well,
Mrs. Marvel,
yes.
How many people are you preparing it for?
What?
Mrs. Marvel,
Yes. Go.
could you also put in there that you have to make sure it's a sealed, watertight container? Put those things inside that.
Is that in our chapter?
I'm not real sure. I don't remember, but I used to live in North Carolina and we always
Okay.
used to have to make sure we put it in a sealed,
That's really,
watertight container.
that's a really good idea. I hadn't thought of that. I'm not sure that is part of the little box in chapter 14. That's a good idea, but I don't think it's not relevant for this particular chapter. Does that make sense? So if you're asked a question, so hang on, if you're asked a question, you're teaching a family how to prepare their kit for a disaster. Here's what applies, right? The family should stock enough food for 3 days, review the kit every 6 months, ensure they all know where it's located, how to turn off utilities, reviewing supplies. That's 5 or 6 things that you could answer from a select all that apply. And so what the other student just said, that's important. But this is what we need to know for this chapter. Does that make sense? I'm not saying it's not important. Actually, it's a really good idea. Questions about how to prepare a family for a kid, prepare a family for a disaster. And this summary is right in chapter 14 as well in a box.
It's page 240.
Page what?
240.
Okay, there you go, guys. So put off to the left here is 240. And then whoever just gave us the page, did you find where Healthy People 2020 objectives are?
Oh, man.
Okay, so let's keep going while she's looking for that. What is the purpose of a mass casualty exercise? Has anybody ever participated in a mass casualty exercise?
Yes, ma'am.
And what
Yes.
what is it? What's a mass casualty exercise?
It affect more than one person.
What?
It affect multiple people.
Right? And why
Okay.
do you do the exercises?
So you know what
Um,
to do in case
Disaster
something
In
happens.
case something happen.
Yep,
So
disaster
you're prepared and
preparedness.
you're organized.
Yep, that's exactly right. Disaster
And you know the
preparedness.
time frame, like when how long it take for the fire department, police,
Exactly.
anything that you need, how long it would take them to get to you.
Exactly. It's all about preparedness. For those of you that work in wherever you work, there should be a disaster plan. There should be a critical response plan, disaster plan to any kind of emergency. And you, I'm sure, have drills, right? I know we did in the schools, we had drills every semester in every school. Okay. You should all be part or at least know what that disaster management plan is in your work environments, because as nurses, we're going to be expected to participate in every level. What are the four phases of disaster management? Prevention. What else? I'll start with the first, prevention. This isn't on here. I'm just asking that. Prevention is the first and recovery is the fourth. What's in between?
Preparedness
Yep.
and implementation.
Yep. And then recovery. Implementation's response. Yep.
Mrs. Marble.
Yes.
As far as the mass casualty goes, quite a few years ago, right in front of my house, a vehicle ran into the back of my son's school bus, and the school bus was clear full of young kids. So that was a mass casualty incident. They had fire
Absolutely.
departments from everywhere. That was not a drill, unfortunately.
Yep.
But that's why they do them.
Absolutely. So the purpose of mass casualty exercises in any community is to evaluate the agency's response and capabilities and preparedness, actually. Right? One of the priority, here's a word. So if you get asked a question about mass casualties and it says, what is the priority outcome, right? Would be for the amount of time it would take for the emergency responses to be activated. Early response systems can decrease the casualties while increasing availability. So if you had a question that talked about mass casualty and said, what is your priority outcome? Well, priority is the key word. All the outcomes all your answers may be correct answers as far as outcomes, but what is a priority outcome? And what is the priority outcome? To evaluate the amount of time it would take for emergency response to be activated. Get it?
Healthy People 2020 for chapter 14 is on page 239 also.
Did you guys get that? So second bullet under disaster management is page 239.
Yes.
Thank you very much. I really appreciate that. And while I'm thinking about it, for all of the latecomers, please make sure your name is in the chat with your professor so I can send them along attendance. Okay. Last part about disaster is their response. So when a federal emergency has been declared, who is the primary organization that takes over? Okay. It's called the National Response Framework, NRF. Okay. And what are they going to do? What do? They may provide specific needs to the community. Okay. The role of the NRF is to support the community experiencing a disaster. And here's the things they help with: transportation, temporary housing, medical resources, search and rescue, firefighting. So if you have a question about the National Response Framework, based on that information, what might you get?
Another select all that apply.
About what would the question be? What might the question be?
About what does the NFRF provides?
Exactly. Yep. So you need to think about, that's how I go through the study guide, is think about, okay, community refers to dimensions of person, place, and function. Okay, what might I get asked about that? How many dimensions are there? I don't know. There's 3. What are the dimensions? Oh, they're person, people, and function. Okay, maybe I'm given a scenario and asked to identify, is this a dimension of place, person, function? Make sense? Maybe back to getting data during a community assessment. Well, here's the way I just collected a whole bunch of data. Is this data gathering or data generation? Windshield survey. I'm conducting a windshield survey. What should I be looking for? Select all that apply. I don't know. That's the way I want you to think about each of these when you read it. Does that make sense? And again, I'm only highlighting the highlights of the paragraph, but you need to know the whole paragraph. Okay, we just went through disaster management. So you're right. National Response Framework is one of the main agencies that respond to a disaster. What do they help with? And here's your answer: transportation, temporary housing, and all those. Right? Okay, economic influences. Okay, I didn't go through this with my class because it was a chapter 9 or week 9 chapter, but I want to here's what we need to know about economic influences. Okay, and economic influences, this relates to for community health, economic influences for community health. Okay, so a primary prevention strategy aimed at an economic issue would be to work with an insurance company to provide the necessary coverage. The shift in the general approach to healthcare from a reactionary acute care orientation toward a proactive primary is necessary to achieve not only more cost-effective, but more equitable health care system in the United States. So let me give you an example to support this. We have a lot of roles, right, as nurses in the community, working in community health. Okay. The example I can give here for a primary prevention strategy, say you have a client who has a rare disease. Okay. And let's say their insurance coverage doesn't cover this trial medication. Okay. One of the roles that you can do as an advocate for the patient, even primary, is to go and speak with that insurance company, right? Let them know that even though it's not covered, even though maybe that medication's not covered, it's going to be economically beneficial to provide this patient that doesn't have this coverage with this life-saving drug, as opposed to caring for this patient over the lifespan for complications from this disease without taking the drug. Does that make sense? That's my real life example of how we can influence, how we can have an influence on the economic side of healthcare. And that's a primary prevention strategy. So you are taking the initiative to go work with the insurance company to say, hey, I think it'd be better to do it this way, even though it's not covered, because it's going to save in the long run. Right. So that is the shift we're talking about right
I think
here.
that's a lot of insurance companies do that now. Like they will let you, like for example, if you get a gym membership, they would pay for it, or
Exactly.
yeah, things like
Exactly.
that for prevention.
Exactly. That's a great. That's another great example. Yeah. Where your work comes with a gym membership. Why? They're trying to be preventative. They're trying to be proactive in helping you maintain a healthy lifestyle. Right. And so the general shift approach to healthcare goes from a reactionary, meaning it's already here and we have to deal with it, to a proactive. Right. So one of the things, most of our healthcare focuses on reactionary. You deal with the issue when it's at hand. But we really, really, and the shift is taking place. The shift is towards primary prevention. We did this in the schools with education for the kids early on at all levels, preschool, elementary, middle school, high school. We did numerous primary prevention strategies, numerous education programs, how to eat healthy, what are the consequences of smoking, what are the consequences down the road of obesity, how do you choose a healthy diet? I mean, school nursing was full of primary prevention strategies. Does that make sense? So we can have an influence. Okay, if we can get to the elementary school kids and talk to them about the long-term consequences of drug use down the road, not to get into it, peer pressure, that's the goal, is to be proactive, not reactive. Okay. Anybody have any questions about economic influences? Okay. So how are we using health information? Okay. So when we're developing, this is about developing community-based education programs. All right. Well, you're not going to be able to develop any kind of community-based program. What's the first thing you need to determine? You have to know who you're doing it for, who you're planning
The
it for.
needs and who you created it
Yeah.
for.
Yeah. When developing a community-based education program, first is you have to figure out who the population is. Otherwise, how can you develop a program if you don't know who your audience is? Right? And so the nurse will identify the issue that requires education. I don't know, let's say, what do we want to do? The nurse will select and identify an issue that requires education, and then she'll select the learning theory and then choose the teaching strategies. Okay, so there's four important pullouts from this little paragraph. First, you have to have a population, identify the issue, select a learning theory, right? And then choose your teaching strategy. So that's a lot of information, but that's what we need to focus on for developing community-based programs. Right? You have a population that has a certain issue, you select a learning theory and your teaching strategies. Okay? And you should have reviewed this in class, right? Learning is examined through 3 different domains. Without looking at this, tell me what each one of those are. What is cognitive?
Maybe like your maturity level, or
Cognitive is thinking. Cognitive is thinking through memory, understanding, reasoning. Okay. Affective focuses on feelings. Okay, focus on changing values and exploring feelings. It's right in here. Gives you a quick definition of each of the 3. Affective learning focuses on changing values and exploring feelings. Cognitive learning focuses on thinking through memory, understanding, and reasoning. And then psychomotor learning focuses on performing a skill. So I always think of the psychomotor learning as that teach back method. right? How do clients learn? Performing the skill. Psychomotor, an example of that is going out in the community and working with new parents, showing them how to bathe their new baby. And then they teach it back to you, making sure they understand, so that you can make sure they understand it. Okay. Hang on one second. I'm going to jump to this PowerPoint because there was a good, I think it was down in the 30s. Nope. There was a, hang on. Sorry. When I was going through this, there was a nice slide about cognitive. Sorry. Okay, I'm not gonna go back through that. I don't want to get sidetracked here. If you need examples in the program, it was in the chapter of program development. It talked about the 3 different domains of learning. It had a nice little summary box if you want to see the examples. All right, I gave you an example of psychomotor. Okay, so here's we just talked about the teach back method. So in teaching a client, right, the nurse should use the teach back method to evaluate if the learning was effective, right? Teach back method focuses on having a client restate or demonstrate what was taught. When teaching a skill, the nurse would have the client perform the skill. Who has done the teach back method with their clients out in the field?
All the time.
Yeah, I do it all the time.
All the time. Yep. Okay, so when designing an educational program, nurse should develop the program's message so the participants will clearly receive it. And then this goes through a number of points that you should consider when designing your educational program. Okay, so that's what this paragraph is about. What should we consider, right? Develop the message so the participants clearly receive it. Keep the content to a limited number of points to avoid overwhelming the learner. Active voice when presenting the content. Okay, so there's 4 or 5 things in here when designing the program, right? So let's see, develop the program's message is 1. Keep the content limited to a certain number of points. That's number 2, right? And why? To avoid overwhelming the learner. Use an active voice. Why? When presenting the content. Handouts and posters are useful, right? And you could use stories and examples to deliver the content as to avoid statistics and a bunch of medical lingo that they don't understand. Okay, so you have to be able to shift, in community nursing, a lot of it is a lot of your role is education. And so when you're designing programs, you may be working with, what do you do with the hearing impaired group? What do you do with the visually impaired group? What do you do if you're teaching preschoolers? What do you do if you're teaching high schoolers? What do you do if you're teaching group of elderly clients? Okay, those are all the things all these things you need to address depending on who your population is. The message, the points, how you present it. Do you need more, for a visually impaired audience, do you need more posters, handouts? Or I'm sorry, do you need more, auditory for the hearing impaired, visually impaired? What about the younger kids who have shorter attention spans? How do you keep them engaged? You just need to know your audience. Okay. And in this last paragraph, we pick 3 different audiences for you to be aware of. Adult learners all have different preferred methods of learning based on their generational characteristics. I learn different than my kids. Would you all agree? So we break it out into three preferred groups. Generation X. Okay. They're self-directed and like to work in teams. Okay. The net generation prefers digital methods, including web-based everything, right? Virtual reality simulations. Okay. And then we have the baby boomers. Okay. Generation prefers instructor-led instruction. So taking this, what kind of question might you get from that? Maybe you're given a scenario of a group of people learning a certain way. And maybe you're asked, is this a Generation X learner group? Is this a net generation group, or is this instructor led? Or you're given a scenario of Generation X learners and asked, how do they best learn? Pick the best answer of how they best learn. But those are the 3 generations to focus on. Okay. Any question about that? Okay, so that's program development using health information, community-based education programs. Okay, government, the law, and policy activism. Okay, this first paragraph talks about liability. It's liability, malpractice, liability concerns. Doesn't matter what area of nursing you're working in. It doesn't matter. Okay, you will be working under a code of ethics, scope of practice. And so you need to be aware of what your practice guidelines are. Okay. And when it happens, there's always liability concerns. Okay. And here we're talking for case managers, but this comes from the case management chapter, but there are 3 conditions that need to be met. Okay, for the liability malpractice concerns to raise to a certain level. Okay, the provider has a duty to provide reasonable care. A breach has occurred through an act or an omission of an act. And the act of omission has caused injury or damage. All right, so malpractice could be considered with case managers if all these 3 conditions are met. Okay, so case managers must strive to reduce risks, practice wisely within their acceptable standards, and limit their legal defense costs through professional insurance coverage. That's something that students ask me about. Do I need to get insurance coverage? That's your own decision. Okay, I can't guide you with that, but a lot of people have asked me about that. But the most important thing to remember here is that you have a scope. You have a scope to practice within. You have ethical standards, a scope of practice to practice within. And what you're trying to do is minimize your exposure to liability and malpractice. Okay.
Blood sugar.
I'm sorry?
For your.
Okay. The Shepherd-Towner Act. Anybody know what that is before looking at this?
Protect women and kids.
Yep. It's the Shepherd Towner Act play an important role in development of public health policy, public health nursing by creating standards for early developmental screenings, number 1. Okay, so if you're asked, okay, select all that apply that the Shepherd-Towner Act, what did they create? What did they do? What was their purpose? Select all that apply, or give you a scenario and asked which legislation, which act applied to this scenario. Okay, so creating standards for early developmental screenings. That's number one, providing health services to women and children by nurses. That's number two. They help define the role of government in research. Number three. They designated client education as essential. Number four. And then number five, they developed a system for collecting national health statistics. Okay, so that's a lot of information, or a lot of role. They were involved in a lot. Whoops, took out a D there. Sorry about that. Okay. Okay, this next slide was Healthy People 2020. But in this particular chapter, we talked about the changes in the goals of Healthy People 2000 over 20 years. Okay, there is a nice box in this chapter that has three, if anybody can find that for us and give us the page number, that'd be great, that has three sections. Okay, the left-hand side is Healthy People 2020 goals in 2000. And then the middle column is that same goal, what did it look like in 2010? And then the third goal is, what is that goal from 20 years ago look like now in 2020? Okay, so Healthy People 2000 initially became a national effort to improve America's health over 20 years. Well, we're there now. We're at 2020. And remember back to the very beginning of this class, you were asked to go in and take a look at the website and do a do a case study for Healthy People 2030, right? So we already know there's a Healthy People 2030 website already up there. Okay, so the one thing we would like you to know about Healthy People 2020 over 20 years is that the first goals were basic and focused on increasing the years of life, reducing health disparities, and improving access to preventable services. Okay, so that's what a goal looked like. That's what their goals look like in 2000. Not 2000. 2000. Okay. And then you look at those same goals. If you pull up that box, you look at the same goal over 20 years, and then that same goal is expanded on the original goals to be more specific and focused on descriptive outcomes. For example, attaining a high quality life and living a long life free of preventable diseases was 2020, 20 years later. Okay. So at first the goals were basic and focused on simply increasing the years of life. 20 years later, that same goal went to a higher quality of life and living longer. Does that make sense? So we do need to know that. How have the goals over 20 years changed? Well, what you need to know is they were first basically focused on increasing years of life, reducing health disparities, improving access to preventable services. 20 years later, you take all those goals and then add on some descriptive outcomes, such as attaining high quality life, living longer, free of preventable diseases. None of that was in 2000. So this is simply how they've evolved. Okay. Make sense? What is the World Health Organization? What is their goal? Okay, their goal is to attain the highest possible health for everybody. And so when you talk about for all persons, you know that that is a global organization, right? We have global organizations, we have national organizations, we have state organizations. Okay, the World Health Organization is the one organization that focuses on global health. All right, so when you see the words all persons, that's global. Okay, and then it goes through what are some of the services provided by the World Health Organization. Okay, they monitor adverse drug reactions, number one. Establish standards for vaccinations, number two. They disseminate biomedical research, number three. Providing information on internationally occurring diseases, 4. And then fostering collaboration for public initiatives, public health initiatives for countries. So what kind of question might you get asked there?
Select all apply.
Right, but what kind of select all apply? What's the question?
What is the goal for the World Health Organization?
Yeah. Yeah, so if World Health Organization is a global organization, what are their functions? What do they do? Select all that apply. Or here's a scenario of, let's see, what organization monitors the adverse drug reactions? Is that a global organization or is that a federal organization? Okay, because the next paragraph talks about federal. Okay, so here it's World Health. And then here are some federal agencies that have a significant impact in public health that you need to be aware of. Okay, so World Health is global. Okay, and then our federal agencies that have an important impact in public health. Number one, the Agency for Healthcare Research and Quality. What do? Well, they're responsible for improving quality and safety of healthcare through measuring quality indicators. Okay, so that's one. What does the CDC do? Responsible for monitoring health, detecting problems, implementing prevention strategies. Next one. What does the Health Resources and Services Administration do? Right? They improve the health status by providing education and funding for healthcare professionals. And lastly, what does the NIH do? Center for Biomedical Research. So what would happen here? Maybe you're given a scenario and ask which agency of these 4 is going to be responsible for that. So if you get a question that's a scenario that talks about quality and safety, what agency monitors that? Well, that's the Agency for Healthcare and Quality Research, right? What if you get a question that says, who's responsible for monitoring health, detecting problems, and implementing prevention strategies? Well, that's the CDC. Okay, so there's 4 federal agencies and 1 global agency. I'm trying to break this down for you. Does it help to go through it this way? So it's just not reading and reading and reading and reading. Is this helpful?
Yes, ma'am. I think
Yes, it is.
Yes, it
Yes,
is.
I
Yes.
appreciate it. Thank you.
Okay,
Yes,
okay,
thank
let's
you.
keep going. How far? I gotta be mindful of time here. What do we got going here? Okay. Okay, case management. All right. Here's what you need to know. Kate, what is a case manager? What does she do? What does he or she do?
advocate for a client.
Okay, what kinds of clients do we case manage? Easy clients or complicated clients?
Complicated people that can't really care for themselves or doesn't take care of themselves or that are maybe have a mental issue.
Yep.
That's
Yep, that's exactly right. And the kinds of clients that require case management, like you just said, are usually clients that have very complicated, I don't know, I just turned the heater on, it's cold. Can you hear all that background noise? Because I'll turn it off. Is that distracting? I'll turn it off.
I can't hear it.
Types of clients that we manage are clients with multiple issues, right? That have a hard time coordinating their care, because nurse case managers work to meet the health and well-being of clients through coordination of care. That's what case management is. We are the coordinators of care. So it doesn't matter what area of nursing you're going to be working in, you will be functioning as a case manager. I feel like I'm always functioning as a case manager, when, especially in the schools, right? Let's say I'm working with a specific student. Well, I might have to pull OT and PT, OT, PT. I might have the doctor. You know, if it's a student with lots of health challenges, I may become the case manager to coordinate how to best effectively have that student in school successfully. Okay, case managers may be discharge planners, right? You're working with all the stroke patients who are going home, all the patients that had cardiac surgery, right? In the case management chapter, there's a box that has a list of all the kinds of patients we could be working with. Traumatic brain injury, substance abuse, and the whole list. I ask my students in class, what is the common theme with this whole list of potential clients that a case manager could be working with? And the answer is they require an extensive amount of coordination of care. Okay. So I'm going to do this paragraph first. Nurse case managers work to meet the health and well-being of clients through coordination of care. That's what case managers do. Healthcare providers such as nurses, physical therapists, dietitians have specific roles that provide education, interventions, and support to clients. Okay. And so let's say you're the nurse working on the floor of a stroke floor, right? And there's a discharge nurse case manager, and she is planning all the discharge, right? Well, as the nurse, you would be working with that case manager, right? To let her know what requirements does this patient need at home? Do they need oxygen, right? What do they need? Do they need medication, help with their medications when they get home? Do they need cooking? Do they need ADLs? What do they need? So the nurse should report to the case manager information that requires coordination of care. Okay, such as the home equipment requirements that support priority interventions, which would be the ABCs. Let's say you had a question about, okay, the case manager is planning on sending a client home. Here's the needs they need at home. They'll need oxygen, they'll need help with their meals, they'll need help with their medications, they'll need help with ADLs. Which would be a priority that the case manager has to deal with before they even leave the hospital? What would the answer be? Priority. What?
Would it be oxygen?
The oxygen, why?
Because, like you said, it was the most important things are
Right.
the ABCs, so
Right.
airway, breathing, and circulation.
The client can't go home and not have any tanks of oxygen there to transfer over, correct? Because they won't, the other things are important, help with medication, help with food, help with ADLs, but what's the priority? If they're leaving the hospital on oxygen, they're probably going to have a transported tank of oxygen. What must they have at their doorstep waiting when they get home? Oxygen. So that's what the case manager does. That's the coordination of care. Okay. And then the case manager also is responsible for promoting self-determination when advocating for the client. What is self-determination? What do we want the what do we want the client to do? What does self-determination mean?
Yeah, mindset to get better, like they gotta be determined to take part in their care.
And they need to be correct. In addition, they need to be
repeat it.
participating, right? We want them to be participating in their outcomes, right?
Right.
This is all part of advocacy. We want to promote self-determination. Okay, we want them to be participating in the nursing process. We want them to be participating in the assessment and helping us determine what their needs are, right? They can help us gather information. We ask about their values, what their beliefs are, right? We want to include them in every process if they're capable. We want to include them in every process of every aspect of the nursing process in planning their care. So the classic process of this is all about advocacy. Okay, the classic process of advocacy includes informing, supporting, and affirming. We want them to be part of the process. Okay. Okay. All right, moving down, violence and abuse. Okay, here's what we want you to know about that. And I reviewed this extensively in my class. Okay. Most important thing to take out of our chapter of violence and human abuse is what can we do to help try and prevent it? Okay, so we're talking primary prevention with regards to violence and abuse. Okay, so primary prevention begins with an entire community approach. Okay, that's the most important thing. You can't do it alone. If you are the community health nurse and you are trying to work on ways to prevent, educate about violence and human abuse and how to prevent it, it's going to take a group of people in the community. Okay, it's going to have to be a community approach. Okay, and here's some of the sections of the community that you want to pull in. You want to pull in criminal justice. So who is that? Law enforcement, right? The courts. You want to pull in education. Okay, that would be your schools, maybe your resource officers, your principals, your superintendent. Got to pull in social services, right? Advocacy groups in the community, you've got to pull them in, right? And then you've got to pull in the public health sector, public health department. Okay, so if we look at violence and human abuse from a primary intervention standpoint, it's a group effort. Okay, it's a community approach. Several different parts of the community need to be brought in to do those assessments, do the educational planning. Okay, so here's what some communities have done. Here's some examples of primary prevention. School-based curriculums that teach children and youth how to cope with anger, stress, and frustration, so that they can also teach good communication skills, mediation skills. Right, that can start at a very early age, right? You can start that in preschool. And obviously, the way you teach a preschooler versus an elementary schooler, middle schooler, it's all in the approach. But you can start that process early on. You can provide family programs that teach parents how to deal with their children more effectively. You can develop preschool programs to develop intellectual and social skills. What's one of the biggest negative impacts we've seen with kids coming now 2 years later, coming out of COVID? Talking about kids in specific, what have we seen? Go ahead.
Isolation, depression.
Isolation, depression, lack of learning, lack of resources. And what potentially is, or it already is to some extent, what does that lead to? Possibly violence, right? Public education programs that can educate communities about different forms of violence and ways to get help and intervene. Maybe it's self-defense classes, right? How do you get help? Rather than responding with violence, how do you get somebody, rather than you reacting in getting involved in the violence, how do you stop and reassess it and get others involved? How do you get help? Nursing home visitation programs with families at risk may prevent child abuse and neglect. I think that child is supposed to say, this is elder. So violence and human abuse. What this last bullet, I'm going to highlight it in red because I think that needs to be reworded. What this is talking about right here is elder abuse. We know that elder abuse is very common. So if you're the community nurse, public health nurse doing home visitation programs with families at risk, you need to be able, no, I guess you need to be able to identify. Nope, I know what that means now. You need to be able to, oops, sorry.
Mrs. Marble.
Uh-huh.
I have seen where they have been, down south have been putting some like preschool in nursing homes, because that can help
Sure.
with forms of violence, they're saying. And I'm not, I'm not sure how that's working, but I think it's a good idea for both kids and the elders.
Absolutely. Right. You have to be able to identify risk factors at all age levels and come up with strategies, hopefully primary prevention. Well, the goal is to come up with primary prevention strategies to prevent this from even happening. But during your home visitation programs, you have a wonderful opportunity to identify families at risk. All right. You may be able to identify, that's what's in that whole violence chapter. How do you identify child abuse? How do you identify child neglect? How do you identify elder abuse? That's what this is all about. That's what this section of violence and human abuse is all about. How do we become educated and recognize early symptoms of abuse? But even prior to that, what kinds of things can we do to maybe help prevent that abuse? And you just gave a great example of preschoolers in the nursing homes. Okay. We still have quite a bit, man. Okay. All right. Infectious disease prevention and control. Vaccines are one of the most effective methods of preventing and controlling communicable diseases. Okay, that's a fact. Okay. They have not been eradicated, so children need immunizations, right? So in the US, in the United States, we have no shots, no school legislation. Okay. Which results in most of the kids are immunized. I'm usually at I don't know, anywhere from 92 to 90, not 92 or 100%. So you're going to have, at least in the schools I worked in, up to 8%, maybe 10% of noncompliance. Okay. Who are going to be the group that's most vulnerable to noncompliance? Okay.
Religious.
So here it is. Many infants and toddlers, the group most vulnerable for severe diseases, do not receive the scheduled immunizations on time. Why? Okay, so here's a fact. Many infants and toddlers, the group most vulnerable to these potentially severe diseases, do not receive scheduled immunizations. Okay, why? Well, surveys show that inner city children from minority and ethnic groups are particularly at risk for incomplete immunization. Children from religious communities whose beliefs prohibit immunization, right? Or whose parents have a philosophical objection. Okay, so here, this gives you some risk groups, right? That may be more at risk for not being immunized. Okay, so it tells you several things in here. Infants and toddlers are the most vulnerable group. Okay, why? Okay, that gives you some other risk groups, inner city kids from minority and ethnic groups, children from religious communities, parents who have philosophical differences, right? Research also suggests that adolescents have lower rates, right? Because maybe they don't access the preventative care that they should be. So what kind of question might you get here? What kind of vaccine question might you get here? Who's at risk, right? And why are they at risk? Right? Well, here's all your reasons of who's at risk and why they might be at risk. Okay. Okay. Next section, HIV infection, hepatitis, TB, and STDs. Okay, we know that STDs are a major public health concern in our country. All right. And what this paragraph talks about is the difference between bacterial infections and viral. Okay, that's what I want you to take out of this chapter, or out of this paragraph. Okay, gives you example of bacterial, right? Says that bacterial, most of these can be cured with antibiotics, right? But STDs caused by viruses cannot. Okay, so what's the difference between a bacterial and a viral STD, right? If it's a virus, they're chronic and can lead to a lifetime of symptom management. Okay. And then here, important to know, syphilis is transmitted transplacentally. What does that mean? What does transplacentally mean?
Maybe given to a baby.
A baby.
And then what can potentially happen if untreated?
Baby may go blind.
Yeah,
Blind.
serious problems within a few weeks. It gives you some right here. Untreated, premature, can cause premature stillbirth, blindness, death, facial abnormalities, disability, and death. So the highlight from here is that we know that STDs can be bacterial, which can be typically cured with antibiotics, but if it's viral, it cannot. And here's an example of an STD that, if it's not treated, can lead to significant problems with the fetus and baby. Okay. Surveillance outbreaks. Okay. I've already highlighted this in green because I went through this with my class yesterday or a couple of days ago. So this particular chapter is just simply definitions. I mean, look at all the definitions in here. Okay. So observation and surveillance is the process of, think of the nursing process, collection of data, analysis, interpretation, communicating, dissemination of health data used to monitor disease trends. That's the simple definition of what surveillance is. Right? You're surveilling. In order to surveil, what do you have to do? Well, what are you surveilling? You have to collect data, analyze it, interpret it, communicate it, and evaluate how to monitor the disease trends. Does that sound like the nursing process? Yeah. So that's how the nursing process is thought of when we're monitoring surveillance outbreaks, right? Purpose of observation is to assess the public health status, identify the disease patterns, set priorities for the resources, and develop programs for rapid response. Okay, so don't just go with my little green highlights here. I'm just highlighting a word. You need to know what it means. So what are some surveillance systems? I'm going to get moving a little bit quicker here so you can read through this. Surveillance systems, right? They're essential into protecting the public's health, right? It's helping you assist with early detection and implementation of interventions to reduce mortality and morbidity. Here's 4 systems. It tells you exactly what they are. What's a passive surveillance system, an active, a sentinel, a syndromic? You can read that. And then what are the patterns of occurrence, right? How did it occur? Well, you know, when you're investigating outbreaks, how did it occur? Was it a point source outbreak, which means, right, all people were exposed to the same source and everybody gets ill. So for example, that might be a gas exposure on a train. Point source, all people are exposed, everybody gets ill. This is patterns of occurrence means how did it occur? What's an intermittent outbreak, right? Maybe intermittent outbreak refers to exposure to a source over a period of time, where maybe people get sick at different times, such as with food poisoning. Let's say there was a bad batch of, I don't know, whatever, chicken, and the batch was served over 3 days. Okay, it's so people have been exposed over a period of time and they're getting sick at different times. Right, and then they have a mixed outbreak. An example of mixed is the flu. Propagated outbreak is an example of TB. So read through this. When developing community-based programs, right, for community outbreak or outbreaks, how do you conduct a needs assessment? There's 4 stages of it. Tells you what these 4 stages are right here. Okay, preactive, reactive, inactive, and interactive. Tells you what all of them are right here. And then we go through 3 models of program planning, right? On talking about surveillance and outbreaks. We have the patch model, right, which simply focuses on helping or mobilizing the community to act. You want the community working with you. Then you have the AP EPH model, focuses on assessing and setting priorities for health problems. And then you have the MAP, MAPP. So I've highlighted 3 different models for you in here: the patch, the assessment protocol, and the mobilization protocol. Okay. Okay, next is managing quality and safety. I mean, we manage quality and safety in every area of nursing we work in, whether we work in occupational health, school health, home health, the hospital, the clinic. You're always managing quality and safety. Okay, always. So when determining if a program has enough resources to continue, the nurse is evaluating the program's sustainability. So this is about program evaluation. Okay, so let's say you have done this big project on disease prevention. You've picked a topic and done a big program on it. Okay, and you were given funding by the county. Well, now it's time to reapply for your funding. Okay, they're going to want to know, you're going to have to articulate certain things about your program, okay, in order to see if it's going to be sustained, right? Did it meet the program objectives? I'm right here. Did it meet the program objectives? That would be one thing that you would want to evaluate, right? Was it effective? Okay, so this is, this paragraph is about program evaluation. Okay, when evaluating long-term changes in a program, right? Did it have an impact? Right? in the evaluation did it address the needs? Okay, so that's what that paragraph about is. How do you evaluate your program? Let's say you're having to, it costs money to put it on. It costs money for the venue. It costs money for food there. It costs money for materials to put on your program. It costs money to bring in speakers. It costs money, you know, it's an expensive program. Okay, so now how do you, when you resubmit your application for funding again for the next year, what kinds of things are you going to have to talk about? Was it successful? Okay, so continuous quality improvement is a structured approach to improving performance. Okay, so it's right. If you're asked about what continuous quality improvement, an example of it is, it's continuous. It's right in the term. All right, it's a structured, ongoing approach to improving performance. All right, where you're always looking at improvement opportunities. So that may be, I don't know, let's say you work at a big hospital and they send out a survey, you know, what's working, what's not. Or they send out a survey to patients after they go home. What worked, what didn't? Okay, how was the food? How was the visiting hours? How was your care? How was I don't know. You're always looking for ways to improve. Continuous quality improvement. We're doing that in nursing, continuous quality improvement. How can we always be looking to improve our performance, our care, our standards, right? So you're focusing on identifying process improvement opportunities. Okay. Okay, where on the other important word, here is quality improvement, we also have quality assurance. Okay, so the definition of quality assurance is also in the name right here. How do you assure that you're getting the quality of care that you should be? Okay, so quality assurance focuses on accountability. That's the difference. Okay, every large organization and even small organizations have quality assurance departments in their hospitals, right? So if something happens, if there's an error, if there's, they're the ones, quality assurance, you do the investigation on why the error occurred, not so much fixing blame, but who may be responsible so that we can work with that department or nursing floor or nurse to do post-event investigations and a plan for improving the quality so it doesn't happen again. Does that make sense? So there's a big difference between quality assurance and quality improvement. Okay. When developing a quality improvement program, to improve client satisfaction for services, the program should focus on ensuring staff is aware of customer service. All right, so monthly educational classes for staff should focus on competence. All right, educational materials in different languages to improve communication. All right, so this is what we just talked about. Okay, so after we do our quality improvement survey, we then go back and talk to the employees about what is the expectation of customer service for our patients. Okay, well, this month we're going to focus on how do we do this with the patient. The next month we're going to focus on a different activity, right? So you're always trying to improve the quality. And here you might be providing educational classes to your employees because your employees have to understand what the customers want. And in order to meet the customer's needs, it's always nice to have ongoing education programs, right? Okay, tracer method. What is a tracer method? Okay, it's a measure of the process of outcomes. Okay, so if you are looking at measuring the outcomes, the tracer method is very specific. Okay, here's what you need to have. So if you're looking at the tracer method, you have to have a group of clients that are selected to evaluate the differences in outcomes resulting in our standards. So for example, clients that participate in, say, a program using the tracer method have to have several things the same. Same disease, same stage of illness, same lifestyle, same intervention, and live in the same community. Okay? So this was the example I was talking about at different hospitals. Okay? You're looking at outcomes. Okay, so if you're looking at 5 groups in 5 different sections of your community using the tracer method, first of all, they all need to have the same of all of this. Okay? And then you look at whatever care you're providing, right? You evaluate the outcomes, right? Let's say you were looking at discharge times or the length of time they need physical therapy or the length of time they need occupational therapy, right? You look at outcomes and improve your nursing care standards based on the outcomes of this group. Does that make sense? That's the tracer method of measuring outcomes. Does that make sense? And if you don't understand it in here, go back to the book. Okay, it has much more detailed information about the tracer method. But what we need to know about the tracer method, it measures outcomes. But you can only measure outcomes using this method if you have the clients that have the same commonalities. Okay, tertiary quality prevention focuses on the outcome of a quality improvement project that decreases the incidence of disease and improves the quality of life. That's a pretty good description of tertiary prevention in general. Okay, I know we're talking about managing quality and safety, but that's a good definition. Focuses on the outcome of quality improvement project that decreases the incidence of a disease, improves the quality of life. So tertiary quality of prevention includes tracking community incidences of complications from, say, a vaccine preventable disease. Developing an education. Okay, so this gives you 3 examples. So developing an education on vaccinations is a primary prevention. Do we understand that? So I'm going to start there. Developing an education on vaccines is a primary, right? Because we want to educate parents that vaccines are the most important prevention for diseases, childhood diseases. Okay. Secondary could be providing low-cost vaccination clinic at the local elementary school and reviewing data. That's a secondary prevention, right? Because we're identifying who's at risk for maybe not being able to get vaccinated and then take your vaccination clinic right to the school, right? So you've early identification. Okay, so you've identified families at risk and then done an early intervention, which is take the clinic to the school. And then tertiary, so I'm kind of going backwards here. I'm going to put this in red because I want to redo that. Tertiary focuses on the outcome of the quality improvement project. Okay, so after you've done primary, secondary, right, then your tertiary, you already have the disease, right? So tertiary focuses on tracking the community incidences of complications and treating those people. Okay. I know this is a lot of information. We're getting close. We're in the home stretch. This is important when evaluating quality outcomes. Okay. How do you evaluate them? Okay. There's phases. Okay. There's your structure phase, and it tells you what it is. During this phase, the nurse will determine if the philosophy and objectives align with the job descriptions. Okay. And then you have your process phase, right? The nurse will evaluate the quality of care by reviewing nursing care procedures, identifying professional procedures. Okay, and then you have your outcome. Okay, so this is all part of evaluation. Okay, there's 3 phases: structure, process, outcome. It tells you what each one of those are. Okay, I only highlight that in red because I want to redo that for the next term. Okay, ethics, really, really important. Ethics in public and community health practice. Okay. I know we only have 9 minutes, but I do want to get through this. You guys, no, we only have one more. Let me skip down here real quick. Cultural influences in nursing. What we need to know in this section is that the 2 populations we focus on are immigrants and refugees. We need to know the difference of what the needs are here for immigrants and refugees. Okay. That's those first 2 paragraphs. So you might need to go back to the book to read up on that. There's a couple of really good the case study in this chapter is really good, which whatever the chapter is, I've sent you the case study. So this is the all about cultural competence. This is your cultural competence chapter. Okay. And then the 3rd paragraph down here, 3rd and 4th, talks about honing in on Native American cultural needs and Hispanic cultural needs. In the cultural chapter, there is a box, and it goes through 4 cultures. It goes through African American, Asian, and then Hispanic, and then Native American. Okay, and it goes through different things like verbal communication. What do they focus on, or what is their culture? Nonverbal communication. What is their culture? Treatments. What is their culture? Holistic versus, non-holistic. So go back and find that box in this cultural chapter, because it does talk about some of the cultural variations, some of the cultural preferences, I guess you call it, for Native Americans. They're often past oriented. Okay, they may not be concerned about the future. So the example I gave in class, and it's on here, right? If you have you're working with a Native American family that needs the instructions are for them to call in 3 weeks for a follow-up appointment. Well, this is an action that's future oriented, right? And we know that Native Americans are often past oriented, right? They may not have a concern about the future. So if their instructions are to call for follow-up appointments in the future, they might need some help. Okay, you might need to help them schedule an appointment. Okay, and then I've highlighted this last in red because I want to change this as well. When communicating with clients who are Hispanic, nurse should avoid use of negative expressions, which is considered impolite. And I know Danielle brought this up. She's in our group now, but she brought this up in class when we went over that. So that's why this is in red, because there was a discrepancy, right? So avoidance of eye contact is usually a sign of attentiveness and respect. That's what I wanted. What was I? Yeah. Does that make sense? So those are the 2 to focus on: Native American and Hispanic with regards to cultural differences and the difference between the needs of immigrants and refugees. Refugees are a lot different than immigrants. Refugees have come in with a lot of stuff going on. They may be here because of disaster, from horrific circumstances, right? What are they going to need? What are their top needs versus immigrants' needs? Well, refugees, first and foremost, are going to need therapy and access to therapy. The priority for nurse when planning care is access to therapy. That's the big difference between refugees and immigrants. Yes, a lot of their needs are going to be similar, but there's a few differences, and that's one of the significant differences with refugees based on what horrific circumstances they have come from. Okay, let's go back up to this ethics section because I want to cover this for the last few minutes. Okay, National Research Act is the commission that has outlined our ethical principles that are to be followed. Okay, so what are our ethical principles? Okay, so we have principles and theories. Okay, so this is broken out into three paragraphs. Okay, the first paragraph is our principles. Okay, principle of respect tells you what it is. Principle of beneficence, principle of justice. Okay, so these are ethical principles. So the ethical principle of respect is focused on obtaining consent and promoting autonomous decisions. What does that mean? Respect for the client. We're going to respect them enough that we want them to be involved. We want to get their informed consent, and we want them involved in the decision making. Right? Your beneficence, the ethical principle of beneficence, is about minimizing risk, maximizing benefit. Justice is the ethical principle that focuses on, well, subject selection, but what it means is there's that justice, that everybody has the principle of justice, that everybody has the same opportunity. Okay. And then we have a few ethical theories. Okay. You can go back and do your own. If you need more detailed information, you know where to find it. We have utilitarianism, right? That it's the outcome. All right. The outcome is the key with utilitarianism. So the action must justify the means. Okay. Then you have your ethical theory of deontology, consequentialism. Okay. And then there's some specific types of populations. There's specific types of ethics here. There are 4 of them to focus on, and they're all different. What does feminist ethics advocate for? They advocate for economic, social, and political equity. Okay, what are virtue ethics? Right, seeks to enable people to be able to flourish, be the best you can. Right, non-malfeasance, do no harm. And then caring ethics, which is the morality of relationships. So a lot of definitions in here, but what you need to know is that we have ethical principles, we have ethical theories, and then we have specific ethics that are important to kind of bring to the surface: the feminist, the virtue, the caring ethics. Okay. And it doesn't matter where you're working in your nursing profession. Ethics, principles and theories are always going to be applied. Doesn't matter, inpatient, outpatient, community, rural, doesn't matter. Ethics is always going to play a big part in your nursing profession. Then the last part is your math, which I went over. Here's some examples of how to know your drip calculations, and then how to calculate your doses. So just some samples for setting up your formulas. Whew, okay. That's it. Tell me, give me some feedback. Let's see. First wait. I need to make sure everybody who signed in, everybody who's on here gets credit for being here. So I need to make sure you have put your name in the chat and your professor, so I can send them this information, send them the attendance. So give me your feedback. Helpful? I know I just covered the study guide, but
It's helpful.
I didn't. Go ahead. I'm listening.
It is helpful, but a lot of information.
It's a lot.
A lot of information
Okay.
and definition.
A lot of chapters.
Okay.
This is the 3rd one that I've attended, and what it's helping do is to separate the information.
Okay.
Instead of it all sort of sounding like instead of it all sounding so similar, it's starting to, it's starting to separate. And if you start to understand the concept, then it feels logical. It's starting to feel logical, like a logical pathway. if you understand what you're dealing with, and you understand what the components of that is. So that's kind of what I'm noticing.
Okay. Thank you, Danielle. Anybody else? Mary Joy? What's your feedback?
It make more sense now. This is my third one too. Then I understand a lot better.
Okay.
This is my first one, but I listened to the other two. The first one I couldn't attend because I was in clinical, but I listened to the other two, and for me, it's kind of starts sinking now, and I'm hoping to be able to attend that last one tomorrow also.
Okay.
So.
All right.
Yeah. This is my third one. I'm coming to, so the repetition is really helping, and I know everybody puts the information differently, but it seems very helpful.
Okay. Thanks, Ebony. I appreciate it.
Yeah, especially the way you break it down within each, like it makes it understandable.
Yeah, if you can break down
more.
each of the little paragraphs to understand exactly what it's talking about, like instead of just reading through it saying, wow, that's a lot of information. If you know they're talking about, certain ethical principles, well, do what I did, highlight the principles and read what it is. Does that make sense? Versus trying to read the whole paragraph together. It just all just kind of
combines together.
Combines. Yeah, it's like a running sentence.
Yes.
Right? So you have to be able to pull out, let's up here on surveillance. If you read this surveillance systems and read this whole paragraph, it's like just a one big running sentence. But if you read it once and say, there's 4 systems in here. There's a passive system, there's an active. Let's stop there and break it out. Let's write down what's a passive system, what's an active system, and just break it down. Same with patterns occurrence. Oh, I read that, but gosh, that seems like a lot of information in that paragraph. Well, let's break it out. Oh, it looks like there are 4 different patterns. There's a point source pattern. What's that? Right? Intermittent outbreak. Well, what's that? Does that make sense? You got to break these down versus just reading it as a whole paragraph. And that's what I've tried to do for you. Right? Yes. When developing a program, you're conducting your needs assessments. There's 4 stages here. What are the 4 stages? Does that make sense? Oh, there's 3 models we should be looking at. The patch model, the assessment model, and the mobilizing model. So that's how you should be breaking this down. And I've just tried to help do that for you and highlight some words. So every paragraph doesn't seem like a run-on sentence. There's a method to the madness, I promise.
It works.
Okay. I'll stay on if anybody has any questions. Thank you for attending. I know it's a lot of information, but the purpose of me going through each paragraph is just trying to break it down, and hopefully so you're not so overwhelmed. And so what I would suggest is that you focus on this study guide. If there's information in the study guide that I didn't review enough that you have a complete understanding of it, like say those different patterns of occurrence. You say, oh yeah, I'm reading in the study guide that this is this and this is this, and here's a short example of it. Go back to the book and read in detail what each one of them are. Okay. So this review isn't fully inclusive. You are going to have to go back and see what you still need help with understanding. Okay. And you're going to have to go back to your resources and find that additional information and do that legwork on your own. Okay. And you have lots of resources to go back and do that.
Yes.
Okay?
Thank you.
But do not overdo it either. Okay. The study guide is a good representation of what the expectation is for the exam. Don't be going out and making your own study guide and making it more comprehensive. It's not. Focus on the study guide. That's what you need to focus on right now. So if I were you, I'd be going through the study guide and, highlighting areas. Yeah, she kind of talked about this, but I still really don't understand it. I need to go back and do my own research on that. Right?
Yes. Thank you.
All right, guys. Good luck on the exam
Thank
next
you so
week.
much for your time, Ms. Marvel. Professor Marvel, I appreciate it.
Who's that? Michael? Hi, Michael.
Yeah.
You're welcome.
Hey,
You're
Ms. Marvel.
welcome.
All right,
You're
thank
very
you.
welcome. All right. Talk to
Hi,
you guys
Miss
later.
Ellen's review tomorrow.
Thank
now?
you. Have a good one.
Yeah, you too. Bye. Have a good weekend, guys.
Thank you, Professor Marvel.
You're very
Thank you,
welcome.
Professor Marvel.
You're very welcome.
Have a great
Thank you,
weekend.
Miss Marvel.
You're welcome. I'll stay on if anybody has any questions.
Yes, do you know what time the review is tomorrow?
Say, I think it's at the same time. Let's look.
Yeah.
Oh, I'm going to stop recording.